Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum, Fearless Against Rabies. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, Fearless Against Rabies. Fearless Against Rabies is a public awareness initiative of Human Biological Institute HBI aimed at educating the public about rabies, promoting timely vaccinations, and reducing the incidence of the disease. Today, we are delighted to have with us Dr. Sanjay Marathe from Nagpur and Dr. Anil Kumar Gupta from New Delhi to share their expert perspective on this very important topic. Understanding zoonotic diseases, protecting people, animals, and communities through prevention. I shall be sharing more about today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, which is a One Health company. IL was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue culture vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first virus cell culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines and currently HBI is a major player in human vaccines. Leader in anti-rabies vaccine segment and is present in around 60 countries. HBI has three state-of-the-art manufacturing facilities, which is at Ooty, Gachibowli and Karkapatla. With the vision of shaping global healthcare by spearheading the One Health initiative, with a mission to innovate, produce, and market quality healthcare products and services to improve and extend lives. HBI believe in providing affordable products with high quality through continuous technical innovations and improvements to meet the customer's need. Some of the key corporate social responsibility of Indian Immunologicals Limited are adoption of government school. IL has adopted two government schools in the vicinity of Karkapatla, which is in Hyderabad, Telangana. It is providing infrastructure and basic facility, including the help of midday meals program. With the help of gift milk program in coordination with NDDB, over 2,500 school-going children from Telangana and Tamil Nadu are being benefited. IL has also donated oxygen generation plant to teams Gachibowli. So these are a few key highlights of Human Biological Institute, a division of Indian Immunologicals Limited, which is a One Health company. To know more about the organization, please visit www.indimmune.com or follow us on the social media sites. On the occasion of World Zoonoses Day, we welcome you to this special panel discussion on understanding zoonotic diseases, protecting people, animals, and communities through prevention. Zoonotic diseases were spread between animals and humans, account for more than 60% of the infectious diseases affecting people, and continue to pose significant public health challenges worldwide. From rabies and avian influenza to leptospirosis and other emerging infectious diseases, these diseases highlight the close connection between human, animal, and environmental health. By understanding the risk and adopting preventive measures, as each one of us play a vital role in protecting families, our communities, and the health of future generation. Welcome to today's episode of Fearless Against Rabies. It is my pleasure to introduce Dr. Sanjay Marathe, a highly experienced pediatrician. He brings 37 years of dedicated service in child health care. With an MBBS and MD and DNB in pediatrics, Dr. Marathe has established himself as a trusted expert in diagnosis and treatment, a wide range of pediatric conditions. His practice focuses on ensuring the physical, emotional, and developmental well-being of children. Currently affiliated with Colors Children Hospital, Nagpur, Dr. Marathe is known for his compassionate approach and expertise in managing neonatal and pediatric health. He has a long-lasting commitment to providing accessible, high-quality healthcare and is a respected figure in Nagpur's medical community. His dedication and skill has earned him recognition among patients and peers alike, making him a cornerstone of pediatric care of Colors Hospital. Welcome, Dr. Sanjay. It's a great privilege and honor to have you with us today. It is my It is my pleasure. I'm pleased to introduce Dr. A.K. Gupta, who graduated from Maulana Azad Medical College, New Delhi in 1973. He is currently practicing as a rabies consultant and family physician at Rana Pratap Bagh since 1980. He is associated with various hospitals like Fortis Hospital, Sundarlal Jain Hospital, Ashok Vihar, Vinayak Hospital, Devarlal Nagar in North Delhi. He is actively associated with Indian Public Health Association. Dr. Gupta has been regularly writing articles on rabies. He has presented various papers in rabies at scientific conferences. His articles on rabies are published in various medical newspapers. Welcome, Dr. A.K. Gupta. We are truly honored to have you today. Welcome, Doctor. No. Yeah. Yes. So, Doctor, today's, as you know, the topic is for the discussion. We are on World Zoonoses Day and we're celebrating World Zoonosis Day today, which is on 6th July. And as we start the discussion, so my first question would be to Dr. Sanjay. What exactly zoonotic diseases are and why are they considered growing public health concern today?
Good evening, everybody, and it's a pleasure for me to be here on this platform and a discussion on such an important disease. See, the today being the World International Zoonotic Day, it is very important for us to know what is zoonotic diseases. The diseases which are transmitted between the animals and the human beings are the zoonotic diseases. They are also called as zoonoses. Now it is because the 60% of the newly emerging diseases in these zoonotic diseases are basically from the animals. These diseases could be bacterial in origin, viral in origin, parasitic in origin, or fungal in origin also. Because of the increased interaction between the animals and the human beings, now the incidence of zoonotic disease is going up. The another reasons why we are having more and more because of the climatic change, because of the deforestation, because of the increased interaction between the animals, because the humans are, you can say, going and taking the places in the forest where they are supposed to be the places for the animals. So we are basically not allowing them to remain in their area, but we are trying to get their area, and that is one of the reasons that interaction has increased. To some extent, unawareness with our human communities. They do not know what personal hygiene should be taken, what hygiene can prevent them from the zoonotic diseases, like simple not to get exposed. And as we are going to discuss rabies, the rabies is the most important zoonotic disease for all of us, where it can be easily prevented. By washing your hands, you can prevent some zoonotic diseases. By avoiding the drinking of uncontaminated water or contaminated food. These are very simple things. But because of the unawareness with the population and with the doctors, still we are having many zoonotic diseases with significant morbidity and the mortality. And the single solution to this of zoonotic disease is concept of one health. That means do not think only isolation in humans. Health for humans, health for animals, and health for the environment. I think the third factor is important. If you can take care of the health of the environment, you are helping the humans and animals to be protected to the great extent. I think this is what we must know about the zoonotic disease.
So, Doctor, as you said, we are observing that in today's figure, what we say is 60% of the emerging infectious diseases are because of zoonotic diseases. So, as you rightly said, we discuss the aspect which is climate change is definitely a big factor which is coming into place because of emergence of zoonotic disease. Dr. Gupta, would you like to add to this discussion?
See, I think the most important thing about the prevention of the zoonotic disease is one health approach involving the human, the animal, and the environmental health. as Dr. Sanjay already said. This is the most important thing. So we must take care of the environment, the garbage part, the other things which become the basically the feeding point for the dogs and other animals also. And they and by managing the environment, definitely prevent the zoonotic diseases by decreasing the population of the dogs and all.
Doctor, apart now we have seen learned about the zoonotic diseases. Basically, what we said that it is transmitted from the animals to human. These are called zoonotic diseases. So, what are which other disease which are zoonotic and definitely it is important for Indian context. Could you please highlight them?
Most important is the rabies, of course. Then the leptospirosis, brucellosis, Japanese encephalitis, scrub typhus, anthrax, swine flu, bird flu, Nipah virus, monkey fever, toxoplasmosis. These are important zoonotic diseases. We must be aware about all these.
Yes. So, Dr. Sanjay, would you contribute in terms of how these diseases are spread?
Yeah, it is very interesting to know how the diseases are spreading.
Yes.
See, there are direct ways and the indirect ways. The direct ways, if the person is coming in directly in contact with the animal, like sometimes in brucellosis, or by the dog bite, or with the scratches which are contaminated with the saliva, what we have seen in rabies. Otherwise, there are indirect ways. Indirect ways means the infection has been given to the humans either through the contaminated water or contaminated food. As we have seen, drinking of a raw milk can transmit the disease. Contaminated food, which is undercooked or not cooked, meat can transmit the disease. Or contaminated water or food can transmit the disease. Then in Japanese encephalitis, it can transmit through the mosquitoes.
Yes.
Sometimes to the ticks. Scrub typhus can be transmitted to the ticks. The Nipah virus can be either transmitted with the contaminated food or with the direct contact. Leptospirosis. Now we are having excessive rains in Mumbai and Pune. So once we have a flood-like situation, then you are prone to get leptospirosis. And you will see in Mumbai sudden increase in the cases of leptospirosis. So there are different ways by which you can get this infection, either directly, like in rabies by the dog bite or the animal bite or with the scratches, or a contaminated food or a contaminated water. See, we have seen with the leptospirosis, then the spread is many times because of the contaminated with urine, rat urine, or with the toxoplasmosis with the contaminated with fecal material. So these are different ways by which you can have an spread of the disease from human to the animal to the human.
I would like to add animal waste also and airborne droplets also in certain infections.
Yes.
So
So,
maintaining
Doctor,
hygiene,
yes.
unsafe significantly reduces the risk.
Now, sir, as we know that currently we are dealing with monsoon. Monsoon is there. So, would you stress upon the certain diseases which we should, as a public or general people, we should be aware of, and what kind of diseases are there, and how do they spread?
Hepatitis is so common. I would like to recommend heavy shower here, hepatitis vaccine also.
Yes, Dr. Marathe would like to add on something like,
Yeah, for the rainy season, we
yeah,
should be more concerned with the leptospirosis, a
leptospira.
flood-like situation. Then, because of the contamination of the food or the water, these are most likely to get infected with during the rainy season. So we are more worried. The farmers will be working in the farms, so they are more prone to get brucellosis like things. People who are working in the fields, they will have more chances of leptospirosis. The scrub typhus, the incidence will go up because they will be working in the farms. Rabies is universal, whether it is summer or winter or whatever it is, you can have the incidence of rabies every time. So during the rainy season, I will be more worried about the leptospirosis, the scrub typhus, the brucellosis. Such thing infections can cause. Even the worm infestations, which will be roundworm infestation and all that.
Yeah, Dr. Gupta, I would like to ask a question like on why is India particularly vulnerable for these zoonotic diseases?
It's because of the extensive livestock, significant stray dog population, and large human and animal populations, and dense urban settlements, variable sanitation standards, high interaction between human and animals. So also is supporting vectors like mosquitoes and ticks. So these are the things which are there in India, and chances of zoonotic diseases are more in India.
Okay. So, yes, because as you said, the environmental factors play a crucial role. So, we have a huge population of human and animal which contributes to this factor. And definitely, it is a big burden on the resources. So, when we talk about and the sanitation also goes for a toss during the monsoon season, and the climate, of course, the tropical climate contributing the vectors like mosquitoes and ticks. So now my question would be to uh, Dr. Marathe.
Yeah.
Uh, Among the zoonotic diseases, actually, what we discussed, which of these zoonotic diseases can be really preventable?
See, the prevention could be because of the vaccine preventable diseases.
Yes.
Some prevention could be because of the good health structure I've provided or good hygiene. If you can give a good potable water, non-contaminated water is available or non-contaminated food is available. These are not 100%. To the great extent we can prevent some diseases, but the vaccine preventable diseases are very important to us. The most important will be scabies, the rabies. The rabies can be prevented to the tune of 100% when the disease is considered to be 100% fatal. Another disease which can be prevented is Japanese encephalitis. Third will be yellow fever. And in some cases, we have anthrax virus, where there is some vaccine which is available, can be prevented. But to my list, if you will say which are having very definite vaccine preventable diseases, on top my list will be rabies. Second will be the Japanese encephalitis. Third will be yellow fever. These are the vaccine preventable diseases. And influenza is basically a bird flu. If
Bird
you
flu.
can avoid, if you can avoid direct contact with the infected bird, you can definitely prevent bird flu from the spreading to the others. And of course, use of boiled eggs, then properly cooked food, whether it is a vegetarian or a non-vegetarian, and drinking potable water. I think these are four most important things by which you can prevent the zoonotic diseases in large.
The most important is rabies.
Yeah.
Yes. So we'll come to rabies as a special discussion. Doctor, as we have been discussing that yes, you have vaccine for certain diseases, but for many diseases, definitely the hygiene plays a big role, and of course, one very important aspect is knowing about the diseases. So if we are more aware of the diseases and how it is being prevented, definitely we can protect. Being aware, we can protect ourselves. Now, my question to Dr. Gupta is, how can food spread zoonotic diseases, and how
See,
can we prevent this zoonotic disease spread from the food?
if it is available in abundance anywhere, becomes a den for the dogs and other animals, stray animals. So it can definitely spread diseases like rabies and all.
Okay, but we have been discussing about food, uncooked food, raw food, or undercooked food. We
Yeah,
also get diseases from contaminated seafood.
the uncooked food like meat also, that can also cause rabies. if it is infected.
Yes. Dr. Sanjay, could you add like any diseases which really comes from this kind of food, like uncooked meat or contaminated or raw drinking raw milk or contaminated seafood?
Doc- Dr. A.K. Gupta sir has very rightly said rabies in the list, but though it is
Yes.
not a very important source of transmission of the disease, but I will put it as toxoplasmosis. If the food is or the water is contaminated with the fecal material of the cats, or a leptospirosis if it is contaminated with the urine of the rats, or sometimes a contaminate, see, eggs are contaminated. So if you take a raw egg, then the disease can spread. So many times if there is a bird flu, the everybody is very scared whether I will get
Yes.
a bird flu, because we had a very bad memory of our 2009 pandemic of flu.
Yes.
And so, to this great extent, that the government has to issue a circular. Do not worry, you can safely eat eggs or a non-vegetarian food, provided you are boiling it properly and you are cooking it properly. So, I
Yeah.
think these are the diseases which can certainly be prevented by taking a proper care.
Doctor, you rightly said we know that avian influenza spreads, definitely spreads to the uncooked food and raw food. And there is one more, which is swine flu. That also is very much crucial, and we quite often get cases for swine flu also. Now, uh, we
Rarely,
have
rarely, even in Kerala, we should be worried about Nipah virus.
yes,
Though we do not see any Nipah virus, but either with the contaminated food or with the direct contact with the infected animal.
infected animal, right? That's great. I think we have discussed quite a bit about various kind of zoonotic diseases. Now we can move on to a very important disease that we always feel that this is 100% fatal disease, and still people are dying because of unawareness. And now my question would be to Dr. A.K. Gupta. Doctor, why is rabies so endemic in India?
This is because of mainly I think it's lack of awareness only. People don't know. I say no rabies, no rabies. KNOW, no rabies. Know about rabies and there will be no rabies. One should be aware about what causes rabies, especially in children. Children are, they keep on playing with the small puppies and all, and are not aware about the dangers which it can cause. And then the bites are sometimes on the head and face area, and becomes category. And then the problems are there. They don't tell at their at their home also. Don't tell to their parents also, and then the whole problem starts.
Doctor Sanjay, I would like to add anything to this. Why India? What are the main reasons why we are seeing it?
I think we should group it into three important reasons.
Yes,
One is unawareness amongst the community and unawareness amongst the doctors.
yes,
Many of the doctors may not be knowing how to treat rabies or a suspected rabies. Then, this is one. Secondly, lots of myths in our community where they will have some local application of some silly things there. Then they feel that once we give vaccine, lifelong my child is protected or the human is protected. Then inadequate treatment,
yes,
either no treatment,
or inadequate.
inadequate treatment is very important. See,
Very important.
category 3 bite you are giving anti-rabies vaccine and no immunoglobulin, the person is likely to die. Then inadequate doses. After 3 doses, they will say, "अरे कुछ नहीं होता, बहुत हो गया." That is another way. Third thing will be from the availability perspective point of view. See, in India, the statistics says only 2% of the category 3 bite people had access to immunoglobulins. It was so costly at that time. So it was not available. Either an anti-rabies vaccine is not available or an immunoglobulin is not available. Now, fortunately, monoclonal antibodies are available, which are cheaper, which are equally good as rabies immunoglobulins. heat stable, can be stored anywhere and will be made available. So non-availability, unawareness and inadequate treatment, these are, I think, the most three important things why we're still having good number of rabies and to the some extent deaths also, where we contribute 33% of the deaths, and almost the WHO says 60,000 deaths per year. I think this is gross underestimation. We
Yeah.
must be having few lakhs of deaths in rabies.
So, doctor, in nutshell, like if I summarize this, when we say one of the what facts is that one of the most important factor which uh, is delayed treatment. Like people come to the clinics because of late, last 2 to 3 years, what certain deaths are reported. People come to the medical practitioner or the healthcare professionals late, but once a person is bitten, the time bomb starts. Actually, we say that the clock starts ticking. So
Correct.
so we
Correct.
need to take it as a very emergency. Any kind of a scratch or a bite needs to be taken as an emergency, and immediately, once after the incident has happened, should reach out to our basically qualified medical practitioners. It is very
So,
important to say.
Absolutely.
something,
Yeah.
before going to the doctor, you must
Yes.
wash the wound with soap and water, running water for 15
Yes.
minutes before going to the doctor. So washing of the wound is very, very important. The first
Yeah.
step. Then he should go to the doctor, and then according to the category, the treatment should be given.
Yes. So as doctor said, that's a very the first aid at home is washing up the wound for 15 minutes with soap and water.
Soap and
Any basically detergent, soap and water at home. Everybody is having, so they can
should be
wash it completely.
running
Yes,
water.
running tap water. Wash it completely, thoroughly, all the wounds, and not single. I think all the wounds should be washed thoroughly, and antiseptic should be applied, right, doctor?
Only povidone is the right one. Povidone
Povidone iodine, yes, povidone iodine,
or
antiseptic, or even if Dettol, it works.
chlorhexidine works.
Yes. So this
And
is
then
the first step what we'd like to have at home. Now, Dr. Sanjay, would you like to add
Yeah.
once the physical barrier is taken out, next step what the patient should do?
I always feel there are three important pillars in the management of exposure to the suspected rabies. The first one, which is rightly said, is wound toileting.
Yes.
Wash the wound, all the wounds immediately with the soap water. Keep the wound under the tap water for 10 to 15 minutes. That will take care of 50% of the viral load in the rabies.
correct.
Yes.
Then apply povidone iodine or a Dettol as an antiseptic. At the same time, do not apply the things like chili powder, cow dung, mud, turmeric. It will
Tuna
cause
also. Tuna.
secondary tuna also.
Yeah.
It will cause secondary infection and no advantage.
Yes.
Third, every small wound, whether category 2 or category 3 bite, must be reported to the authority like a doctor, a qualified doctor with whom you should take the appropriate treatment. The second pillar of the most important thing is anti-rabies vaccine. And the third important thing is the rabies immunoglobulins or monoclonal antibodies. All these three are equally important. We have very clear cut categorization, but I tell you in my practice, only category 3 will come to your hospital. Category 2 will have all the opinions from the community. कुछ नहीं होता से लेके हमने बहुत देखे हैं.
Category
Yes.
even the immunocompromised and the patients with HIV and all, they are important because they are considered for the RIG in category 2 also.
Yeah.
For
So
category RIG is there, but for category 2 in some cases it is required.
yes. So as Dr. Marathe has discussed, like we have wound washing, wound toiletry. Then the second step would be definitely the vaccination. The third step is the immunoglobulin or monoclonal antibodies. All the three steps are very very critical for all the for any kind of exposure.
Yes, doc.
But
Sorry.
yes, the correct advice can be given by a qualified medical practitioner. So that is what we have discussed. Now, Dr. Gupta, can you tell me something? What is post-exposure prophylaxis and something called pre-exposure prophylaxis? So we take rabies vaccine mostly after an exposure, after a dog bite or scratch has happened. So what is this pre-exposure prophylaxis? Is advanced protection possible before an exposure?
Pre-exposure means before the bite. So those who are high risk categories or those who are coming in contact with dogs or other animals, they should take the pre-exposure means pre-bite, before the bite. The schedule is 0, 7 and 21 or 20, intramuscular or intra. And the post-exposure, of course, SNIM schedule 0, 3, 7, 14, 28 days, or intradermal one can give 22202. That means 2 doses on day 0, zero point 0.1 ml, and then 2220 on 14th day. Otherwise, on all the days, we give 222. This is Thai Red Cross ID schedule,
Right.
post exposure.
Yeah. So post-exposure prophylaxis or the that what we talk about is after the animal bite has happened, and we take generally recommended in India is 5 dose schedule, and while pre-exposure is advanced protection, where before exposure we take. So, Dr. Marathe, would you like to tell me the advantage of pre-exposure prophylaxis? Suppose we have taken vaccine before an exposure. Actually, to whom you recommend, and does it give any protection? What is the advantage of pre-exposure prophylaxis?
See, pre-exposure prophylaxis in rabies is a very important step. Pre-exposure means you are giving it before you are exposed to the rabies virus or suspected rabies bite. You are sensitizing the immune system. You are preparing the immune system to tackle with the rabies virus. You are immunizing that individual who is at a risk against the rabies. This is pre-exposure. So pre-exposure, as rightly said, you have to take 0, 7, 21 oblique 28 days, and the last dose acts like a booster, and your antibody titers go above the 0.5 ml international units per ml, which is a protective level in the serum. Now it is said it gives you lifelong protection. Suppose this individual is exposed to the suspected rabies bite, then he has got some immunity. Now he can build up the immunity by his own through the memory cells, and to save him or to achieve 100% protection, we give 2 doses which acts like a booster.
Booster.
Only anti-rabies vaccines are required on day 0 and day 3, where immunoglobulins are not required. So lot of saving on the immunoglobulins. Non-availability of immunoglobulin will not be a problem, and you are 100% protected by just taking 2 doses. Secondly, sometimes the availability of the medical facilities is not available. Suppose somebody is living in the forest and he takes about 3, 4 days, 5 days to reach to the medical hospital. He has got his own protection. So he can manage with that protection. He can take 2 doses subsequently in the 7th day, 10th day, still he is protected. Then who is at risk? Who should be given?
Yeah. Basically,
Ideally,
when we talk about Indian context,
correct.
so
In
it's very
pediatric
crucial.
population,
Yeah.
ideally every child below 15 years of age. But
Yes.
financially it may not be viable, but ideally it should be, because they are at the highest risk of getting rabies. And mortality is highest in pediatric population less than 15 years of age. Then second group, those who are farmers working in the fields, those who are working in the forest, army people, those who are working in the fields like corporation people who are working in the different communities, then those who are staying in the government hostels, where staying in a crowded area where many people are staying and no medical facility, their hostels are in the periphery of the your city, they are at a risk. Then the medical field people, especially veterinarians.
Yes.
then medical health people who are tackling the rabies virus either in the microbiological labs or in the pharmaceutical industries where anti-rabies vaccine is being prepared. So these are the communities where they should be protected on priority. Even the immunocompromised host should ideally be given protection, but then the rule says if the immunocompromised host, even if he is protected, gets a bite, do not take a chance, give him a full protection. So I will not include this immunocompromised individual into that pre-exposure prophylaxis, but it is recommended in this group.
So,
Yes.
such should it include primary vaccination schedule?
Pardon?
Should it not be included in the primary vaccination schedule for
See,
children?
very true. Very good question. I was reading an article in WHO
Yeah.
because India has got such a huge population, and every time we are adding one Australia to our population. So if we'll start giving 3 doses 0721, then
Each
the
week.
WHO says if it is to be a financially viable things against the protection offered, then you should have the incidence of 5,000 dog bites or an animal bite per 1 lakh population in that area. And Cambodia is the only country which has reported 4873 bites per lakh population,
Yeah.
not our country. So, ideally, it will be a wonderful idea. But
Yes.
then, whether it is physically possible, availability of the vaccine, for that, very rightly, intradermal vaccination should be promoted.
But it should not be given below 5 years of age.
No,
Inter-
intradermal vaccine can be given to anybody.
no, after 5 years of age, it is recommended intradermally. But
Intradermally, there is no age limit, but the point is, it is a skilled vaccination.
Yeah.
the child
You are
vaccine,
protecting an
Free vaccine.
individual. You are protecting an individual against a disease which is 100% fatal. So,
according
like we say, if you give BCG, it's a skilled vaccine. The same way, now in the government hospitals, they are training the staff how to give intradermal vaccine in rabies also. So, at present, a private practitioner is not supposed to use intradermal doses. Only it is allowed to be in government hospitals where a trained staff will give you pre-exposure as well as a post-exposure intradermal rabies vaccination.
Yeah.
So you'll require a lot of skilled staff to give it. So there are some issues with the universal immunization or introducing pre-exposure in your national immunization program.
But as you know that India has a huge population, taking up pre-exposure prophylaxis at the public health level or the national level, it is going to be a very tough ask for the government. But when we see the deaths which has occurred for last 2 to 3 days, 2 to 3 years, definitely we can take up awareness vaccination for the parents where people are actually adopting pets or having exposure to the stray dogs and animals exclusively, basically for the children below 15 years who are after awareness of pre-exposure prophylaxis, they can take as an optional vaccine. Now, doctor would like to wind up this session. Dr. Gupta would like to add anything, any message, key message for you for the parents who are watching today.
physically, as I told you earlier also, ignorance and knowing about rabies is very important. One must know how to prevent rabies, how to prevent all. So all the parents, especially, they should teach their children also how to avoid playing with the puppies and how to get away from the dogs and how to be in how to avoid this rabies and all.
Yeah. Dr. Sanjay, would you like to add your key message for the parents and for the Zoonosis Day?
Yeah, I think I will. I would like to say zoonotic diseases are not uncommon. There are many. Many of them are either vaccine preventable or can be prevented by the simple measures like washing your hands or washing the skin and all that before you are entering into your house. Go for the boiled or the properly cooked food. Potable water makes a very important thing, and the public awareness how the zoonotic diseases are spreading is very important. Like in leptospirosis, we have seen, or in Japanese encephalitis, we have seen through the mosquitoes. For the rabies, we have seen with the dog bite. A small scratch by the nail, which is contaminated with the saliva, can cause rabies if not protected.
Even
This is
lick,
what even the leaking on the mucous membrane, which is supposed to be intact one, it becomes a category 3 bite.
on the
Rabies is an 100% preventable disease, but 100% fatal. This message must go to the community. Do not believe in the myths of the rabies. Do not believe in the non-medicos information about the rabies. The community should be made aware, the doctor should be made aware, there should be a standard, you can say SOP for the management of rabies across the country, so that everybody will be managing with the same, and lot of confusion in the treatment. So it should be very clearly told to everyone. And I will say, before you give the anti-rabies vaccine, wound toileting is the most important intervention where which can be done at the community level.
first and the most important.
You will be surprised to know the WHO position paper on rabies says that wound toileting and anti-rabies vaccine has saved 90% of the cases.
90% of cases, yes.
So this is something which is very important, and that message should go to the community.
Yes.
And now, fortunately, availability of them with the monoclonal antibodies, we are very happy. It's
Yes.
very easily available, affordable cost.
Yes. So, thank you all for being, all our viewers for being a part of Fearless Against Rabies exclusive session on zoonotic diseases. We hope today's session was informative and valuable in spreading awareness on zoonotic diseases and especially rabies and its prevention. Our special thanks to our esteemed speakers, Dr. Sanjay Marathe from Nagpur and
Thank you,
Dr.
sir.
Anil Kumar Gupta from New Delhi for sharing their time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Please do like, share, and spread the word to as many, including your friends, family, and relatives. Until we meet for the next live talk, stay healthy, stay aware, and please do good care of yourself. Thank you so much.
Thank you so much. Thank you, Sanjay.